While the community was establishing its first hospitals in the United States, sisters were also beginning their work in parochial elementary schools and orphanages. In 1891, Mother Frances, who was a teacher by profession, accepted 2 schools outside of Wichita, and also one in Bakersville, Wisconsin, 6 miles from Marshfield. Before Mother Frances returned to Italy in 1905 to help in a newly founded kindergarten, she had influenced the founding of 11 hospitals in the U.S., 4 orphanages, and 5 schools. Mother Frances died on March 6, 1911, but her charism of contemplation and action lived on through those who followed her. The sisters continued to give service where there was need. In bleak, rugged New Mexico, they welcomed the opportunity to do mission work among the Hispanic people in the Archdiocese of Santa Fe. The district school of Ribera was accepted in 1914, and Villanueva followed in 1916. As the years evolved, the hospitals and schools thrived as the community grew with new members in both Europe and the U.S. Community life was of utmost importance. The Sisters' Day included work, prayer, and play for the glory of God. In 1927, the American Mother House moved from Marshfield to Milwaukee, Wisconsin. Sisters were trained in the convent high school and college. In 1949, the community accepted their first aspirants, young women who wished to join the sisterhood. With increased numbers, the works of the sisters continued to expand during the 1950s and early 60s. In 1963, sisters arrived in Grenada from Barbados to begin yet another new mission. And in the following year, sisters were also sent to Brazil from the U.S. to serve. These missions grew. In 1966, St. Joseph Hospital in Barbados was dedicated with Queen Elizabeth and Prince Philip in attendance. In the same year, the sisters opened St. Elizabeth Clinic in the capital city of Trinidad, West Indies, and St. Rose Modern Secondary School was dedicated in Grenada. Change was in the air. The documents and decisions of the Second Vatican Council affected every Catholic in their beliefs, attitudes, and practices. Religious life was shaken. Sisters were called to return to their roots, renew, and refound. While the Sisters of the Sorrowful Mother changed their garb, their mission did not change. They continued to serve others in need in the name of Jesus. Prayer and contemplation remained an intimate part of their lives. Post-Second Vatican Council was a trying time. Sisters left the convent to fulfill new roles in the changing church. The diminishment of the number of sisters resulted in closures, but also enabled the congregation to work more closely with the laity in their healthcare and education ministries. The sisters continued to meet the challenge and address the needs of God's people, especially the poor, through their healthcare and education ministries. In 1993, they responded to the call to help educate the very young in the Dominican Republic. While rural preschools were established, family health issues were also addressed through the SSM Foundation. In 2001, the Franciscan Institute for Personal and Family Development was established in the West Indies. Through this ministry, the sisters, SSM associates, and their collaborators provide programs that assist youth, adults, and families to improve their quality of life through nonviolent ways of relating to self, others, and creation. While there have been many changes over the years, the sisters, the associates, and other partners in ministry serve in 10 countries and continue to meet the ever-present challenges. In response to a call to address the crying needs of the extreme poor, they began their first mission work in Tanzania, Africa, in 2006.